Welcome to everybody to EuroPCR 2021. It is really pleasure on my side to host this MagicTouch session about new drug-coated balloons. Dr. Bernardo Cortese and Dr. Sandeep Basavarajaiah will be with me discussing this interesting topic. I will give an overview of drug-coated balloon, and then we go into specific questions with my panels. Thank you very much. Bernardo.
Yes, thank you, Antonio. So since you are a recognized master of PCI in the world, we would like to know and to understand currently in 2021, which is your main indication for using a DCB in your daily practice now? Why do you use a DCB instead of a stent?
That's important. I have three ways, three indications for use of DCB. One is in-stent restenosis, and I highlight the fact that lesion preparation is essential before moving to DCB for in-stent restenosis. Second is small vessels smaller than 2.5 or 2.5, and in this regard there are published randomized studies supporting what I just said. And third, maybe the new indication to limit stent length, to not use the stent when the result is clear and beautiful without a stent. So to limit the usage of stent when a stent is not absolutely needed. This is not a competition with stenting, but is a way to avoid the full metal jacket and to be a little bit conservative towards using very long stents. So, Dr. Sandeep, you are an expert not only in the usage, but also in the way nanolute technology, which is a MagicTouch technology, works. Can you go in detail and explain to us what are the key features of this drug-coated balloon?
Thank you, Dr. Colombo. So in regards to MagicTouch, I would like to give some background. As you know, the MagicTouch technology got its CE mark in 2016. Now, one of the main limitations of putting a sirolimus drug on a drug-coated or a balloon is the poor lipophilicity of the drug itself. Whereas paclitaxel, it's very easy to deliver into the vessel wall because it's highly lipophilic, and hence most of the DCB we have are paclitaxel coated balloons. Now, Concept Medical has been a pioneer in inventing this new technology called the nanolute, where essentially what they've done is they have filled the sirolimus drug in nanoparticles which are highly lipophilic, and these particles carry this sirolimus drug, and they are coated on the balloon. Now, upon inflation in the vessel, in the coronary arteries, or even in the peripheral vessel, these little particles, the nanoparticles, get into the vessel wall, then releases the drug, which then exhibits its anti-proliferative action within the vessel wall. So if I show you the next picture, this is quite interesting. You could see here. So these are the sirolimus particles, which are encapsulated in a drug carrier, which is a phospholipid, so highly lipophilic, and they use a dedicated spray coating on the balloon surface. And when you inflate the balloon, these particles get into the vessel wall, and then they release the phospholipid or the limus drug. Now, we have been using this technology since 2018 in our unit, and we have done over 600 cases till to date with MagicTouch. We have published our initial experience last year in CCI journal, and the latest data of these 500 patients, we have a real-world data from our center, which is quite encouraging. Okay, so I'll just give a little summary of the data. So as I said, we have had over 500 patients data now. The patients are quite complex, and so is the lesion, because it is reflected in their demographics. So 40% of the patients were diabetic. We had 17% of patients with a CKD, and 40% of them were in a restenotic lesion, and 60% of the cases were in acute coronary syndrome. And the vessel diameter was generally less than 3 millimeters. So almost 60% of the lesions were in vessel less than 3.0 millimeter, and the lesion length was 26 millimeters. So these were long lesions, small vessels. Despite this, the clinical outcome with a median follow-up of 18 months, we have seen a low cardiac death, which is 2%, and a low target vessel MI, which was 4%. The TLR was 10% with the overall MACE rate, which was defined as a cardiac death, target vessel MI, and TLR was 11%. So despite the population being complex and the lesion being complex, the revascularization rates on the hard endpoint especially are acceptable. Technically, this is one of the very good DCBs I've come across, especially in terms of deliverability, because we have not had any MagicTouch where we fail to deliver into the lesion, even if it is a distal tortuous calcified lesion. So that data appears promising, although we need more data in terms of registry, which is ongoing, and also a comparison with the paclitaxel, which is an RCT. Again, we are all part of it.
So Dr. Bernardo Cortese, who is a real expert, not only in the field of MagicTouch, but in the field of the drug-coated balloon, is going to give us a summary of his experience with this device, and also update us regarding the clinical program of drug-coated balloon, Sirolimus eluting MagicTouch. Bernardo?
Yes, Antonio, thank you for this question. And I'm really happy to tell everybody here in EuroPCR 2021 that the three of us, you, Antonio, and Sandeep, are running really an important clinical program about MagicTouch. MagicTouch started doing some, providing some safety data with the Fasico studies, which showed that the midterm follow-up that this device was safe, and also the preliminary data that it was effective. Then we decided to have some experience with the Eastbourne, which is going to be the largest registry on DCB ever. We have enrolled more than 2,000 patients, and we are going to present this data with a primary endpoint of TLR in 6 or 7 months from now. And then we decided also to run 3 additional studies with MagicTouch. The first one is Transform 1, which is actually comparing MagicTouch with paclitaxel coated balloon in a small vessel disease setting. And we are enrolling patient in the study. The chairman with myself is Professor Serraius. And then we have Transform 2. Transform 2 is going to enroll patients, real-world patients with a complex native vessel disease. And we will enroll patients and randomize them between MagicTouch and Everolimus eluting Stent. And then we are pushing this limit forward because we have designed the Piccoletto 3 study, which actually in the real life and really complex setting is going to randomize patients between paclitaxel coated balloon, MagicTouch, and drug-eluting stent. And now we are talking about CTOs and very, very long lesions. So I think that I hope that within 2 or 3 years from now, we will be talking about MagicTouch as a standard of care for our coronary artery disease patients.
So thank you very much, Bernardo. Very interesting. I think this wheel is turning really completely. We saw drug-eluting stent being the standard of care and are the standard of care, but now drug-coated balloon is emerging as not really as a competitor, but as a niche from the beginning, but maybe something more than a niche. So I'm really very excited to see what the future is going to give us. Thank you. Thank you so much.
Thank you, everybody.
Thank you. Thank you, everyone.